We're back, and let me show you the story I was talking about. Because the pandemic from the very start was wrapped up in politics, red versus blue, from masks to lockdowns to anti-vaxxers, some states have doubled down on the anti-science, anti-medicine, anti-expert movement. It leaves the public exposed in matters of public health. Tonight, senior Washington correspondent Hallie Jackson reveals exactly what some of those state legislatures are up to.
Before businesses opened back up and before people put away their masks, protests against those pandemic precautions spread across the country. Now, that backlash against what some saw as overreach seeming to spur a new movement. At least 14 states have introduced or passed bills that would limit the power of state officials in the next public health crisis, according to a new report by a coalition of health leaders. In North Dakota, that's a ban on mask mandates. In Kansas, a new law would prevent the governor from shutting down schools. And in Ohio, the legislature could overturn any order issued by the governor or state health department in a public health emergency. State Senator Rob McCauley co-sponsored it.
This was aimed at putting in place checks and balances in response to an unprecedented set of circumstances and an unprecedented use of executive power at the state level.
But at Wolf's Ridge Brewing in Columbus, Bob Suter, who struggled to keep his business open during the COVID crisis, wants public health decisions in the hands of the experts, not politicians.
You know, it's scary to be in Ohio and think that if this does happen again, our legislative body is going to be the ones that decide, you know, essentially what we do to keep each other safe. And I think it's a bad idea.
Other opponents of these laws describe them as downright dangerous.
We don't want to risk anybody unnecessarily being hospitalized or worse yet, dying when we could have prevented that from happening through some simple mitigation public health measures.
So that was Hallie Jackson. Our thanks for that report. Dr. Nahid Bhadilya remains with us. Doctor, is this where we are now, that we'd rather, take a chance on death and quiet down those overeducated public health types?
Right. My real concern is that, when you face these types of emergencies, and we now live in the age of epidemics from novel pathogens, we're learning about how they're jumping from animals into humans, and that's happening at an increasing rate. You have a new disease, and what's happening, and the challenge with these is that you learn about the disease as you respond to them. And so you need somebody, nobody bats 100% because you're making public policy in the setting of changing science. And you want somebody who has prior experience and background in dealing with this. My concern is with these laws is that they're saying that they're putting in checks and balances. I see that as actually getting rid of checks and balances, because there are periods of times where political expediency, it does not match what is required from a public health perspective. And we also live in an age of disinformation. And so I'm concerned about what's going to happen when that next outbreak or epidemic shows up on our shores.